school time. After 10 o'clock, when you're sure that you don't have to go today, we all feel we'll start playing, we'll do our things. Right? So, if there is a pattern of such behavior for a longer period of time, it is called school refusal. So, school refusal can be difficult, can be defined as difficulty attending school, and that thought that they have to go to school, it is associated with distress, a lot of stress, emotional stress, anxiety, depression, right? And school refusal is often characterized by um, ഒരു, um, it triggers a high anxiety and stress, right? And there will be separation anxiety also. So going to school means being separated from parents, from caregivers. So that creates a lot of tension. So the child might feel that, okay, if I go to school, something will happen to my parents, to my mother, to my father. They, some accidents will be there. They might die. Or if I go out, I might be kidnapped. Something will happen to me. So the child will also feel like that. So these can be a separation anxiety factor for school refusal. And another thing is, they say that there can be three clinical groups for the school refusal. One thing is phobic school refusal. They are scared of something. It can be, if they have a presentation, if they have examination, if they've not completed some homework, something. So they're scared of something. That is phobic school refusal. Then separation anxious school refusal. It means that they have separation anxiety. They don't want to be separated from the parents. Then anxious, depressed school refusal. So in that, they might be um, they might have anxiety about certain things, or they'll be depressed, right? They'll have those symptoms, and because of that, it can lead to school refusals. Okay, so some of the okay, so do you know what is truancy?
Sorry, ma'am, what is it?
Truancy. Do you know what is truancy?
Truancy.
Persistent absenteeism without a reason or without a cause.
Not without a cause. School refusal is also absenteeism, right? They are not attending school.
They are quite rebellious in nature.
Truancy?
Truancy.
Rebellious. Okay.
No, I mean, we typically talk about bunking persistently right now. They have a cause, but it's not like a good enough reason to stay out of school.
So the main difference is in school refusal, the parents clearly know that the child doesn't want to go to school, or the child is not going to school. They are aware of it. But in truancy, parents do not know. So the parents will think that the children are at school, teachers will think that the children are at home. So no one knows that the child is bunking. That is truancy. And they'll be bunking the class for antisocial activities, most probably. Okay, so it can be use of drugs, it can be use of some including in some fights or crime. So some antisocial activity they'll be including it. They'll be participating in. And another thing is some common home environment of children with truancy are inconsistent disciplining, marital issues between the parents, and if there is inadequate supervision, very liberal parenting style, right? And personality traits issues that will be there. Okay, and they'll have similar friends also, friends uh, who engage in truancy and also involved in antisocial activities. These can be some common characteristics of children with truancy. Okay, so according the classification of school refusal, so they say that there'll be two types: neurotic and characterological. So neurotic, it consists of younger children with dramatic onset. Okay, so for example, separation anxiety, they'll be very clingy, they'll be, they'll cry, tantrums. So all these symptoms will be there for neurotic group. And characterological group, it is mainly for older boys, and it is gradual onset, maybe later after, let's say, it's not an early onset. Okay, so later gradually it is this ഒരു behavior might be there, and they might have some school phobic symptoms earlier. Okay, so when they are, let's say, 5 years, 6 years, they might have some trauma or phobia towards school, and later when they are 7, 8, 9 years old, they might have this school refusal. Okay, so there is type 1 and type 2 school refusal. Type 1, uh, so the classification I told now, it is by Coolidge and Hallen. They told about neurotic group and characterological group. According to Kennedy, school refusal can be divided into type 1 and type 2. In type 1, uh, presenting illness will be there. They say that some excuse. Okay, so I am not well, fever, stomach ache, headache. So like that fever they'll tell. And then Monday onset. Okay, so Monday onset following an illness the previous Thursday or Friday. So from Friday they might hint that okay, I'm not feeling well. I think I'm tired. So they might hint about the illness, and Monday they'll tell that okay, I'm not well. And acute onset, so it is immediate onset. Okay, so that can also be there. Then lower grades will be there for their scholastic performance will be low. Expressed concern about death. So they'll say that if I go to school, something will happen, I'll die, or my parents will die. Death, concern of death will be there. Mother's physical health is in question. Okay, so they fear that something will happen to mom. Okay, if I go out. And nothing is good communication between parents. So here there is no discord or interpersonal conflict in the family. There is good communication, and mother or father are well adjusted. So there is a cordial relationship between the parents also. So father is competitive with mother in household management. In the sense both does their part. Okay, so father is also engaged in household activities. He also does his part, and parents achieve understanding of dynamics easily. So they understand, how to deal with the relationship, the interpersonal communication, the interpersonal pattern among the family is good. Okay, so the school type 2 school refusal, the main ഒരു differences are the death theme will not be there. Then when mother's health they'll not be concerned about, and there will be poor communication between the parents. Okay, and mothers might show some of psychological issues like neurotic behavior, and father might have personality issues. Okay, and father will show very less interest in household activities or in taking care of children, and parents are very difficult to work with. You cannot have a proper communication, you cannot make them understand anything. Okay, so these can be type 2. Otherwise, all other symptoms are same for type 1 and type 2. Okay, so coming to development of school refusal. So it can be academic or social reasons. Okay, so it can start with some small things like they didn't do a homework, they didn't do an assignment. So it can start with that, and it can also be because of any trauma happened in the family. It can be because of a divorce, or it can be because of death. Okay, so that can also be the reason. Okay, or the child might fear that something terrible will happen at home if they go to school, or something terrible will happen to them if they are on the way to school. Okay, so children who are struggling with school and academic issues. Okay, so with their studies, they're not able to study well, they don't understand what they're teaching. So in that case, they can develop school refusals or other things, social issues. So they have issues with the friends, with the peers, or they are not able to form a good relationship with the children in school. So again, that can lead to school refusal. And children who have missed a lot of school due to illness or surgery. So if there's a surgery required, or a medical emergency, they might miss school for 1 month. Depending on the severity, they might miss school for 3 weeks, 1 month. So coming back to school, coming back to the routine, coming back to the classroom again, adjusting to that environment, right? And they have to catch up with all the syllabus. So all these can create or cause this school refusal. And another thing is attention, secondary reinforcers. So to get mother's attention, to get father's attention, they might say that they are not well and stay back at home, or they want to just sit back, sit in empty play, then watch TV. For that also they can they'll have this school refusal. Okay. And if it is untreated for a longer period of time, then it have a lot of implications in their adult life also. Okay, so they'll have poor social relationship. They might not be able to their school performance in future might get affected. They might have psychological issues, right? Anxiety issues. Okay, so all these can be there. So refusals among, let's say, 5-year old till 5 year, it's very common. Every child will have that, because till that time they are with their parents 24/7, and things happen in their own way, right? Whatever they want, they can do at home. So suddenly they are sent to an environment away from the parents, where they have to follow so many rules, where they are, where there is an authority figure who is controlling these children or controlling them. So at that point of time, every child will go through this school refusal. But beyond the point, let's say 6 years, 7 years, then it's an issue, right? Then it should be taken seriously, and immediate intervention should be given. Okay, so the children, they might show clinging behaviors, excessive fear, worries. They might always shadow the parents. Okay, they'll not leave. They'll walk, complete, exactly shadowing, walking behind them, not going away. And nothing is difficulty going to sleep. So they'll have difficulty going to sleep. They fear that, okay, tomorrow morning if I sleep, then again tomorrow morning they have to go to school. So that kind of thought will be there. Then frequent nightmares, exaggerated and unrealistic fear of animals, fear of being alone in the dark, and severe tantrums when they are forced to go to school. So all these can be some of the common characteristics or common behaviors of children with school refusal. Okay, and coming to family factors of school refusal, they say that uh, if the parents had any of the anxiety issues, okay, so if they had um, depressive episodes, there are high chances that the child will develop um, school refusal. They might have separation anxiety disorder. And again, if the family interaction pattern, family communication, everything is um, interrupted, or if there is an issue in that, again, it can cause issues. It can cause um, school refusal, right? And coming to assessment, again, the frequency, intensity, and duration should be clearly noted. Okay, so if they are having more than 2 times per week, then uh, you know, intervention should be given. And the pattern of family communication and interaction. So how the family is communicating, what kind of interaction they are having, whether there is a proper hierarchy or whether it is more flexible, right? Whether um, everyone is happy with their roles, with their responsibilities. So that should be taken clearly understood. And if there is a family history of anxiety or substance abuse or mood disorders, that should be noted down. Then family history of school refusal, if parents had this condition, that should also be noted down, right? And some of the scales, these scales can be used, interviews can be used. You can observe the behavior of the family. So all these are some of the assessment techniques. Okay, so coming to the intervention of a school refusal, our goal uh, of this intervention techniques can be, one thing is to facilitate child's returning to normal functioning. So without feeling that tension, without feeling that distress, how to make them go to school, go back to that routine. Then make the child tolerate normal separation from caregivers without distress or impairment in functioning. So they have to be away from the parents for this many hours. So you are reducing the distress, tension from that, anxiety from that. Okay, so that they can comfortably go to school. Then to make the child attend school consistently without experiencing distress. So make them attend school every day consistently, right? So these can be the goals for intervention, and some of the techniques we can use is CBT, cognitive behavioral therapy, because they have this irrational thought that something might happen to them, something might happen to me. So that thought process should be changed. Okay, for that, some systematic desensitization, exposure, operant behavioral techniques, kind of classical behavioral techniques, all these can be used. Modeling, role playing, relaxation techniques, these are some of the techniques that can be used for treating this. Then family therapy, again, very important. Okay, so if there is any maladaptive pattern, interaction pattern, communication pattern in the family, that should be identified, and parents should be got into the school, and assessment should be done. So you can encourage the parents to have a bit more positive, supportive environment in the family, right? And encourage the children to talk about their fears. Okay, so you can sit with the child and tell them that it's very normal to be scared. I also was scared. Okay, so the parents can tell that it's very normal, it's okay. When I was a child, I was also scared to go to school. You can share some personal experiences, how you overcame it, right? So I did this and I felt good. Do you want to try that? Okay, so you can tell that, okay, for the first few days, I'll accompany you. I'll come to school, I'll stay there. Don't worry, I'll be there. Right? So ensuring them, validating their feelings is very important, right? Another thing is change in the environment. So the it is very essential to identify um, the factors that is causing the school refusal apart from the separation anxiety. So what is it that is causing refusal? Is it the school environment, or is something that happened in the school, or is it because of examination, it is because of assignments, homeworks? So what is the cause that we should understand? Then psychoeducation is creating awareness about the condition to the family, so how to deal with it, what to expect out of it. So everything should be clearly explained, and teachers also play an important role in preventing school refusal. So the teacher can create a very good environment in the class, welcoming each child, right, giving them their own space for expression of their perceptions, their viewpoints, right? So all these can be helpful. Okay, so they have given a example also, right? So that can be done. And the next thing is performance anxiety. So performance anxiety, when they feel that they have to go to the